Good afternoon, everyone. I'm Cameron Friesen, Minister for Health, Seniors and Active Living for the province of Manitoba. I'm here with Dr. Brent Roussin, Manitoba's Chief Provincial Public Health Officer, and we are here for our Monday briefing. Over to you, Dr. Roussin.
Thanks, Minister. Good afternoon. Our current 5-day COVID-19 test positivity rate is 2.1%. 28 new cases of the virus have been identified as of 9:30 a.m. This brings the total number of lab-confirmed cases to 1,214. There were 2 new cases in Interlake Eastern Health Region, 13 new cases in Prairie Mountain Health, 6 new cases in Southern Health, and 7 cases in the Winnipeg Health Region. We have 11 current hospitalizations with 1 individual in intensive care, 469 active cases, 731 individuals are recovered, and the number of deaths due to COVID-19 remains at 14. Preliminary investigations show that 14 of the cases announced today are close contacts of previously announced cases, and 1 was related to travel. In the last 7 days, public health officials have been unable to determine a source of infection for 32 cases. Those are the non-epilink cases, or what we might also determine to be community-based transmission. There were 16 in the Prairie Mountain Health Region, 14 in Winnipeg, and 2 in Southern Health. Case investigations, though, are ongoing, and we'll update those numbers as needed. Testing numbers, 1,714 completed on Friday, 1,992 on Saturday, and 1,708 completed on Sunday, bringing our total to 137,499. Our preliminary investigations indicate that of the 3 cases identified at the Assiniboine Centre at Brandon Regional Health Centre, 2 of the individuals were healthcare workers and 1 is a patient. At this time, it appears the patient contracted the virus while in the facility. A case previously identified in Prairie Mountain Health Region is a healthcare worker who works at Fairview Personal Care Home in Brandon. This healthcare worker is a close contact of a previously identified case. This information has been shared with families and staff at that centre. Close contacts are being identified and case investigations are continuing. While the current risks are assessed to be low, both of these sites have initiated outbreak protocols and as per our provincial protocols. The site is moving to red or critical in a pandemic response system. This means the sites are putting additional measures in place to reduce the risk to residents and staff and restricting visitors at this time. There is an exposure in Brandon that we are announcing. This is a possible exposure at the Frederickson Performance Center, Unit F, 1212 18th Street in Brandon. Dates and times are August 17th from 7 a.m. to 8:30 a.m. and August 23rd from 9 a.m. to 10:30 a.m. Risk, again, is considered low, but being provided to ensure Manitobans are up to date. We have some update on our clusters. There have been a total of 423 cases in Prairie Mountain Health since July 1. There are currently 250 active cases. A total of 83 are linked to a business in Brandon and 48 are active. In total, 20 cases have links to both the Prairie Mountain Health Cluster and the business in Brandon. There are now a total of 280 cases in communal living situations with 115 active cases. The Bethesda Place outbreak has a total of 10 cases, 7 staff members and 3 residents, 2 of which we have announced before had passed. With the increasing number of cases throughout southern Manitoba, we're going to be re-implementing the travel restrictions to northern Manitoba and to remote communities. This will be effective Thursday, September 3rd. The public health order is very similar to the last edition of that order. So there are many exemptions, and that includes people who live in northern Manitoba or are planning to set up a permanent residence there. People who are traveling to lodges or campgrounds directly, and including traveling directly to Churchill. People who work for federal, provincial governments or a crown corporation or a government agency or a child and family services agency. Health providers will be exempt, as well as those who are traveling for emergency health purposes. People who own or operate businesses and are traveling to deliver goods, provide services, or operate a business, and travel related to parenting arrangements. And the details of that order will be posted on Thursday. In addition to these orders, we're asking that all Manitobans should respect any restrictions that First Nation communities have put in place in their communities. These communities are working along with public health, but certainly may have their own restrictions, and we ask Manitobans to respect that. We know Prairie Mountain Health continues to be at the restricted level, orange, according to the pandemic response system. These requirements here include wearing a mask in indoor public places and outdoor public gatherings. Gathering sizes have been reduced to 10, both indoors and outdoors. A requirement for all visitors arriving at health facilities to wear a non-medical mask to be permitted to the site takes effect tomorrow. It also extends to outpatients attending appointments at clinics within hospitals and health centers throughout the province. While primary care clinics and other locations providing health services are not currently included in the mask requirement, all Manitobans are encouraged to strongly wear a non-medical mask when seeking care. Again, we note that there might be many Manitobans who are unable to wear masks, and so again, please remember to be kind to each other. We have a long weekend coming up, Labor Day on Monday, and so again, we want to reiterate the importance of fundamentals, especially during these times. Again, we want to avoid those large gatherings, especially indoors. Most definitely stay home if you're feeling ill, even just mildly ill. Wash your hands frequently, do not share items with others, practice physical distancing when outside, and if you can't, then certainly wear a mask. And if you're in indoor public places, strong consideration, recommendation to wear that mask. Again, reiterating the importance of self-isolating as soon as symptoms develop, even if they're mild. Go for testing soon after that. But don't go out in public, don't go to work, to school, to events, even with mild symptoms. On that same line, we continue to ask employers to work with employees to limit the barriers to staying home when ill, so that we can encourage people to do just that. Testing, we want to test symptomatic Manitobans unless you're advised by a healthcare provider. So again, individuals and businesses, please refrain from trying to get tested when asymptomatic unless you've been directed to do so. And again, visit our website, manitoba.ca /COVID-19 for up-to-date information. Remember that stigma harms our ability to fight this pandemic, so be kind to each other, and I can now take questions.
I'm just unclear if in Brandon, is it 2 or 3 personal care homes?
Yeah, so there's the Bethesda and Fairview now, and then the site at Assiniboine, which is attached to, is not classified as a personal care home. It's a rehab facility.
And Rideau Park.
Rideau, yeah.
And Rideau Park is, yes, Rideau Park is.
2 care homes in Brandon, 1 in Steinbach.
Steinbach.
Okay.
What concerns do you have? We now have 4 care homes, a hospital. We saw things spiral very quickly with people having to be sent home in Winnipeg in early April. What are your concerns regarding the healthcare system now?
I think that we've seen on a number of occasions out, in the public with spread in Brandon. is that there's a lot of fatigue out there with adhering to the fundamentals and adhering to a lot of the guidelines that are in place that did such an excellent job at protecting us in that first wave. And when we see the spread within some of these personal care homes, we can see that it's challenging to be using PPE consistently. It's challenging to do it for so long. And I think that we have to, get back to that fundamental where not going to work when you're sick, wearing that PPE even though it's tough constantly, because we can see the results of that.
What was the thinking behind not elevating the risk level to red at the hospitals and personal care homes in Prairie Mountain and particularly in Brandon when you went orange for the whole area?
Yeah, well, we had, a lot of measures that were in place. And if we look at these outbreaks, there's, we can see that the measures may not have been implemented as they should in certain circumstances. We're not seeing actually right now any of these cases linked to visitors. And so, we'll keep dealing with it, but we are reviewing those policies quite closely to see what else we need to do.
How did the virus, to your investigative knowledge, get into the rehab unit at the Brandon Hospital?
Yeah, well, it looks like that we have a client who tested positive, who had been admitted much longer than the incubation period, and then we have 2 staff members that are tested positive. So that's the only connection we can come up with right now.
So do you think a staff member, or a patient, or a visitor brought that in?
Well, I mean, the only thing we have to go on right now is this client certainly was in too long to have been exposed outside the facility, and we have just 2 staff members that are positive right now.
How close is Winnipeg to going orange?
Yeah, well, like with any of these indicators, it's hard to say, how, where exactly we are. I think we're monitoring it very closely. You'll look at, say, numbers like, like today where the numbers are not quite as high as we saw over the weekend. We're looking at that. The non-epi-linked cases again, which over the last 7 days again is not overly high, and then the strain on the healthcare system. So all these things, we have to follow the trends in all of those things, and so any region could go into a restricted period quite quickly if we saw escalation of cases, a strain on healthcare system, but it's hard to sort of give a timeline for that.
Is 11 that's a fairly high number of people in hospital, at least compared with recent months? Would be one of the higher numbers? Is that a concern though at 11?
Yeah, like in our first wave, we saw our hospitalization rate at about 10 or 12%. And so when we have, over 400 active cases and 11 in hospital, it's not in keeping with that same number, and having just 1 in ICU as well. We're not seeing that strain right now.
And it comes nowhere near overwhelming the system. I mean, capacity in hospital.
That's right. Yeah. So still have that capacity. We planned for seeing increased cases, seeing increased people in ICU, and so we're still planning for that. But we have not reached that capacity for sure.
Are some of the Winnipeg cases coming from Prairie Mountain health region in Winnipeg?
Yeah, we don't have any direct links to that, and so we don't. We haven't really commented on that, but we don't have anything that tells us that's what's happening.
Can you comment on the test positivity rate coming down? It's been coming down since I think it peaked at 3.1.
Yeah, and so, like any of these indicators, we like to see them trending in the right direction, but we can't conclude, what really that means at this point. Still relatively short duration, but of course we like to see it trending that direction. And to note is this is probably our new norm, is that we're going to see peaks and valleys of this. We're going to see these indicators go up and then eventually coming down, for just waiting for the next peak. So finding those ways to, we always say, live with this virus is what's going to be necessary, because it's going to be very difficult to respond with significant restrictions each and every time we see numbers going up.
Why isn't the COVID app enabled 8 days before school starts?
This is the contact tracing app there. So we've been looking into that. I think it's, using technology, I think is going to be, is a good idea. We're looking at the privacy implications, which I don't think are huge with that app. But just that app's going to require a significant percentage of population to use it, because it's not going to be mandatory, and it's not going to replace what we do with contact tracing. So I think it's, we could be getting down there, but it's not the the big answer that we're all looking for.
But students might use that to quite a big extent, right?
Some might, but we have a lot of things already in place in school to limit those exposures and to ease contact tracing.
When would you see it enabled in Manitoba?
Yeah, I don't know. We have people who are working with that for the Manitoba solution to it, so I don't have a date on that.
Why do you think it's taking so long? And we're not the only province. I think Ontario is still the only one using it, if I'm not mistaken. What's the delay in it? I mean, there doesn't seem to be a downside to it. You agree it's not really a privacy issue. Why is it taking so long to subscribe to this app?
Well, I mean, I think it's been discussed at all levels of government as well. It's out there, and so I can't speak to what the the specific concern is. Certainly, there's privacy discussions. From my opinion of it, I don't think that should be a big issue, but certainly it's an issue to some to look at it. But yeah, you're right. It's only in Ontario right now, and so I think people are just looking at what's going to work best for their region and best nationally.
From a provincial point of view, what's all entailed in adapting this technology or this app?
Yeah, we have our e-health people that are looking at that. I can't speak to the exact details. I wouldn't describe it as that. Yeah.
But that's not the reason for the delay, like technical complications, or that's not the reason we still haven't. Not only are you don't have any imminent plans to do this, right?
No.
Trying to get a better understanding of why it's sort of not going forward in a more expeditious
Yeah.
fashion.
Yep.
Well, I mean, I'll just add this, I'm in contact with my colleagues in other jurisdictions exactly on this issue. There are no principled objections that I'm hearing in other jurisdictions. It is technical. The work to make such an app on this broad scale work with our systems, because it only works well if it's able to return that information to us in a usable form. So I understand that there are some technical aspects of the interoperability that are challenging, and those challenges are being faced in every jurisdiction. So my knowledge is at this point in time that only Ontario has this operating and that other provinces continue to work on it. I would, though, add this caveat, and that is that in order for such a tool to actually have usability, it's going to need broad application. I've heard numbers of 50 or 60%. I think it will be challenging for any population in Canada to get to 50 or 60% of the population wanting to download and use that tool. Will there be some utility if we can't get there? I think so.
You know what it is in Ontario?
I don't know what the uptake is.
Dr. Roussin, how many cases known or suspected do we have of MISC in Manitoba?
Yeah, I haven't been aware of any reports of that to me. So if you look at like Kawasaki, we see Kawasaki disease reported here every year, right? So this is what we see, and so in most of those cases, you can find usually a infectious event, usually a respiratory or prodrome. And so it's not unexpected to see it with a virus like this, but I'm not aware of any cases reported to me.
You said in the past that you didn't think breaking down case numbers by geographic region in Winnipeg was useful because somebody could work in one place and get it in the other. But in other cities, this has been really useful epidemiological data. We know in Toronto, Montreal, we can see the interplay of income, ethnicity, and cases. So when will you make this regional breakdown or even neighbor postal code breakdown available for Winnipeg?
Well, I mean, epidemiologically, we look at all these factors, right? We break this down into many things, right? We know a lot about each and every case that we wouldn't make, public, right? So when we investigate it. So the information that we report to the public, we want to report information that's useful for decisions for the public to make. And so if you saw a hotspot in a certain community area in Winnipeg, I don't know how that would affect your behavior.
But with respect, public health usefulness and public right to know are two different things, as you're well aware, and we're well aware in our jobs. If I look at Toronto and Montreal and Vancouver, and I can see the detailed breakdown and the regression analyses that data journalists can do there, we can't do that here. And I don't, would you entertain the idea of providing more granular data within Winnipeg?
Yes, yeah, and I mean, we did at first, you know, so you see that we broke down the numbers quite a bit, you know, than what we were looking at before, going to the health district. At that time, we decided, for most of the reason I just said, why not, we weren't going to break Winnipeg down further. But, yeah, we can look at it, you know, we want to keep the focus on, the fundamentals are, you know, are the focus, right? So if you look at a hotspot in northern Winnipeg, right, you need to practice fundamentals. If it's in southern Winnipeg, you need to practice the fundamentals. I don't want it to change what we do, because it's actually the fundamentals that will help us.
But since you have access to that data, do you know whether or not their affluence is related to infection within the city of Winnipeg?
Well, we know that there's a disproportionate effect overall, you know, in Canada and this to you know, certainly things like income. We haven't necessarily broke it down by income quintile here, but we know for many factors, there is always a disproportionate effect.
Are you concerned if you give that kind of detail, if it shows there aren't as many cases in some part of the city, that might lull people into a false sense of security, or is that like do you see that as a downside?
Well, that's the downside I see to releasing geographic data, is because it's we want people to be practicing those fundamentals wherever they are, and to see that there is maybe if for instance there was in Western Winnipeg there seemed to be less cases and people, well, I should frequent more restaurants in that area. It's just not advisable. That's not going to protect you.
But on the other hand, if poor areas of the city are harder hit, and it's good for the public to know that, because the public can then maybe put pressure on politicians to do something about that.
Yeah, and so we, you know, when you look at the data, we're going to look at, you know, we are collecting race and ethnic identifier data that we analyze, and you know, hopefully at some point report on that. We know we report weekly on the or what was weekly on the First Nations cases and things. So we are doing things like that. So yeah, you know, there might be a time when we are reporting on that.
Thank you, Doctor. We're going to go to the telephone.
In Toronto, they're using that neighborhood data to decide what restrictions at which schools. What do you say to parents who want to know next week which neighborhoods may be more affected?
Yeah, I would say that we don't have that right now our numbers would not suggest a bigger breakdown in a certain area to have different efforts placed in different schools. So if we look at that all the time, we review our pandemic response system daily to decide if there should be any changes to the alerts, whether that's in a city, a region, or a district.
And first up will be from the Brandon Sun, Colin.
Hi, Dr. Roussin. I was wondering what kind of cleaning and preventative measures are being taken at the Brandon Regional Health Center to prevent further spread of the virus.
Yeah, and so this is a typical outbreak protocol. So there's enhanced environmental cleaning. The ward is essentially locked down, so there's no visitors. Staff are going to work just on one unit, and then we're testing all staff and residents, even if they're asymptomatic at this point, and then of course testing them again should symptoms develop. So just a typical outbreak response that they do every year when there's a respiratory outbreak.
We're also wondering what specifics you could tell us about the contact tracing stemming from those cases. We've had a couple of people reach out to say that they've been at the clinic in the last week, but that they haven't been contacted by anyone. So I was wondering if you could provide any clarity on that.
Well, I'm not sure which clinic they're talking about. This, you know, in the Brandon Health Center, this is specific to a certain ward on a certain floor in the Assiniboine Center. So, so they probably weren't contacted because they weren't on that facility.
They said they were at that specific facility.
Well, we can look into that. It doesn't sound like, this sounds like it's a medical rehabilitation ward. And so I can see if they have outpatients there from what it was articulated to me, that wasn't the case.
From Q Country Radio in Brandon, Braden.
Hi, Dr. Roussin. Braden Natch with Q Country News. I was just wondering, for those that are medically exempt from wearing a mask in stores but unable to obtain an exemption letter online, what should they do, or what can the health authority do to provide them with some proof?
Yeah, and so, we're right now in public health, we're not requiring any medical notes for that justification. So a facility, a private facility can certainly, within reason, and they can get their own advice, but can restrict entry for certain reasons that they see as necessary. So I don't really have advice for what people do to go into private facilities. I just know that public health, when enforcing this right now, are not asking for actual letters.
Perfect. No follow-up question.
From CJOB, Diana.
Diana from CJOB here. Dr. Roussin, we have heard that potentially some of the cases that are showing up in Winnipeg are people who've kind of been working in the Clear Lake area over the summer and are coming back to the city kind of for the start of the school year. Has public health had any indication that that is happening?
That hasn't been reported to me, and so we do that, both contact investigation and acquisition investigation, so I'm not aware of that.
And some people are kind of wondering, ahead of school reopening, are there going to be more testing locations opening up, or more capacity for testing, given that school is kind of coming back and people are maybe a bit concerned about that?
Yeah, I think our plans from the beginning were to be able to, ramp up access to testing as we enter the respiratory virus season, and so there definitely are plans to do that.
From the Winnipeg Sun, Scott.
Hi, Dr. Roussin. Scott Brook from the Sun here. Hearing today or this morning that the province may, and maybe this is a question for both of you, but is the province looking into at some sort of mask mandate in some capacity?
Yeah, I think that we've discussed here that our messaging on masks has evolved over time. And certainly right now, indoor public places, especially when you can't physically distance, a strong recommendation. We've mandated in certainly the Prairie Mountain Health region. And so, like we said, we've had quite significant restrictions in the past. And I think that the goal is to not have to return back to that. That's why we're advising that Manitobans return to the fundamentals, not rely on restrictions to get us through much of this. But the next public health intervention that we have before restrictions is masks. And so if we continue to see trends increasing, if we see community-based transmission in other regions, then that certainly is another public health intervention that we have to utilize.
Okay. And this is, given that we've had a record number of active cases now in Winnipeg, is the province at all considering pushing back the start of the school year?
Well, we haven't really had a specific thought of that. I think that right from the beginning, when we started to plan this, all the divisions were tasked with having plans for each of the levels of opening that we discussed with the reopening plans. And so I think we're going to base our decisions on the cases, what we see. We want to ensure that things are safe when we do go back. We have a lot of safeguards in place now. But we don't have a specific plan on that. But like so many of the other things, we've never removed anything off the table if we thought it was necessary.
From CBC Radio Canada, Catherine.
Hi, Catherine Logan from CBC Radio Canada. Good afternoon, Dr. Roussin. We know that First Nations communities in the North have been asking for a travel ban for quite some time now. What was it that sort of got the province on board in sort of initiating that?
Yeah, I think that, I mean, we've had it done in the past, and I'm, in frequent consultation with AMC, MKO, and the Grand Chiefs, and we've had a discussion about re-implementing these restrictions, what they could look like, what kind of purpose they could serve. And as we just saw increasing numbers in many of the southern regions in Manitoba, just decided that we would move forward with that. So I think we've moved with it pretty expeditiously this time, and they'll be in effect by Thursday.
Great. And just as a follow-up, would you be able to give us just the breakdown of how many cases there are per care home affected?
Well, the cases of for clients is still at the Bethesda, which are 3, and then the other personal care homes were just the 1 staff member at this time, and and then at the Assiniboine we had the 2 staff members and 1 patient.
From the Canadian Press, Steve. From the Canadian Press, Steve.
Dr. Roussin, Steve Lambert from the Canadian Press. Sorry about that. We've been getting a lot of numbers here on a daily basis, but I'm hoping to pull back a bit and get a couple of answers from you on the big picture over the last couple of weeks as we've seen the numbers spike. First off, in Brandon, you talk about a cluster in Prairie Mountain Health Region. The numbers there per capita in Brandon are exponentially higher than Winnipeg. It's obviously much more than the business. The numbers there are just a portion of what we're seeing in Brandon and wider in the Prairie Mountain Health Region. What is going on in Brandon and the Prairie Mountain Health Region that has caused these numbers to rise so much?
Yeah, and so if we look at the just the nature of that cluster, when the case was first determined, when there's a number of cases determined, the nature of that cluster is a lot of family gatherings, a lot of gatherings between people of within that geographic region. So it's fairly numerous people in this community and geographic area, and just a lot of gatherings took place. So by the time the first few cases were diagnosed, there was many contacts. And just the nature of that is just that there's you're going to have a increased case counts just because this is spread by prolonged close contact.
And in both cases of Brandon and Winnipeg, where we're seeing the numbers rise as well, not as dramatically as in Brandon, but we're seeing in both cities the numbers are rising. Is it a case of more community spread, or is it a case of more people who have tested positive having more contact? And what, assuming there's an answer to that, what do you take from that?
Yeah, and so there's both there. So we know that during our the first wave, our first bout with this, we saw the community transmission is about 12%. Now overall, that's closer to 15%, and in Winnipeg and Brandon over the last month or so, it's been up as high as 20%. With it, and you can see the number of non-epi-linked cases are at 32 in the last 7 days. But in addition to that, the average number of contacts per case has gone up over time, and that to me signifies a little bit of stepping back from the fundamentals, that a case is being infectious for longer and having more close prolonged contact with individuals than what we saw in that first bout we had.
From CTV Winnipeg, Michael.
Hi, Dr. Roussin. You may have honestly just said this, but just wondering, out of the cases announced today, how many are linked to community transmission?
Yeah, we did have that number. So remember that these are just early numbers. So I think we had 14 of today's cases are linked as close contacts, and one was related to travel. So the rest are right now listed as community-based transmission, but we just don't, that sometimes is because the investigation isn't complete.
And as you kind of said, the community transmission rate is going up. And what outside of reimposing restrictions and having people stick to these fundamentals, which we have been doing, how do you see in getting that community transmission levels back down? How do we lower that rate without restrictions?
Yeah, well, you just named the most important one is that the people again be aware that this virus is here, and that we have to find ways of getting back to those fundamentals, to practicing what keeps us safe without necessarily having widespread restrictions in place. Because those restrictions, it's very hard, even for, moderate restrictions, very hard to outline every single thing a person does in their day in a order. And so we need individuals to continue to step up like they did in the first wave to limit their contact with others, or certainly their close prolonged contact, and certainly in crowded indoor places. Lots of hand washing, and we note that each time we are talking about an exposure, public exposure, we're talking usually about symptomatic people. And so again, we're losing sight of the importance of staying home when we're ill, even if it's very mild. And so, in addition to that, then like we've done in Prairie Mountain Health, we've added masks in indoor public places. Our recommendation is to do that now, indoor public places, especially when you can't physically distance. And then besides that, then we're back at sort of restrictions. And again, we're going to try to do those restrictions more targeted than before. But we know those restrictions have huge impacts.
From CHVN, Taylor.
Hi, good afternoon. On June 26th, that was the deadline for the provincial for the design concept for those all-season visitor shelters. Can you give an update on that, seeing it's been from a couple months ago?
Yeah, I'll provide an update on that. We're very pleased to be proceeding to be able to accommodate visitation at personal care homes into the fall and winter, because we don't know what's going to happen. And we've heard Dr. Roussin talk very clearly about the fact that we could be seeing a second wave that could be significant. In other jurisdictions, they're simply planning to close personal care homes. We said that isn't good enough here. So it's ambitious. We have a lot of efforts underway. I believe I can update Manitobans at this point and say that we have awarded the contract on the co-visitation shelter. Remember, these fall into two categories. There are the visitation shelters that are being built external and linked to personal care homes. And then there are other ways that interior to the residential care home, there's going to be significant alterations to be able to accommodate the space within. Both are continuing. Both, to my latest knowledge, are on track, and we are expecting to have delivery of these on site starting early in the fall.
And along the same lines, a lot of people want to see their loved ones in personal care homes, but are a little anxious about visiting them and potentially bringing something into the home. What kind of things can people do to visit with their loved ones?
Yeah, and so I think that when you're with this virus, when we talk that we're all in it together, we mean it. So the best way to protect others is to protect yourself. If you practice the fundamentals, then it's very much less likely that you'll be exposed to that virus. If you're not exposed to that virus, then you're not going to be able to expose somebody else to that virus. So if you have a loved one in a vulnerable situation, doing whatever you can to protect yourself will protect them. Hand hygiene, wearing a mask when you attend that facility is all important. And we know how important that visitation is. But as we move in, we know that it's never without risk. So we can't set up a scenario where it's risk-free. So we have to balance that and make your own choices on where that balance lies. but protecting yourself will protect those that you love as well.
We have time for a couple more questions from the floor.
Dr. Roussin, we've been getting some calls from funeral directors, especially ones that operate pretty big indoor facilities. They're concerned about the restriction on 50 persons being allowed. Wondering whether you're given any thought of changing that at all.
Yeah, right now, given the trajectory of cases, we're not looking at really loosening any of our restrictions in any area. We know that funerals have been sites of spreader events. We know that just the nature of a funeral really makes physical distancing unwieldy. So we hear this, and we hear this from from multiple sectors. It's been challenging times. So answer right now, no, we're not looking at loosening that.
Dr. Roussin, given that we have long weekend plans for many people and we've got the northern travel restrictions, can you remind people what that means if they want to go to a northern campground or a lodge or a cabin?
That's right. And so this is all based on that we know that if this virus gets into a remote, isolated community, we've seen in the past that there's a real chance of it spreading and causing significant issues. So these are in place to protect those communities. So if you're traveling to a campground or to a lodge, traveling directly to it, ensuring you're not ill when you're there, minimizing your contact with other communities, and it's just really what we'd say that being COVID safe.
I'm wondering if you could elaborate on something you said a few minutes ago. When you're talking about maybe making changes on mask recommendations or maybe orders regarding masks before more restrictions, adding restrictions. Could you elaborate what you were getting at there?
Yeah, I think that if we see case numbers continue to climb, if we see it, we start seeing indicators that are telling us that we need to do, to have another implementation of some sort of public health intervention, then, our next step for that is likely to be masks.
As opposed to moving up to another code orange
Or as well, it could be part of that, but it's, before widespread restrictions if possible, we'd like to have another public health intervention before that, and really the only thing we have left before that is masks.
On that note, why don't you guys wear masks just to send a visible message to people?
Yeah, well, I do. This morning, if I'm out for coffee, I'll be wearing a mask like this, where we can distance like this. I don't have one on, but I have one with me all the time, yeah.
How much testing capacity do you have right now?
Right now, certainly at that, 2,500 tests a day max for the province, we can achieve that. And so we're constantly looking at, well, yeah, I mean, it's, right now, we have that, but as we get into fall season, remember, things like the supplies, the reagent, are worldwide demand on them. And so we're watching that very closely.
Jurisdictions are doing, I can't remember the term they use, but it's sort of like a bulk testing where they do a number of tests.
Pooled samples.
Yeah,
Yes.
Are you looking at that?
We do that.
Oh, you already do?
Yes,
Okay.
yeah.
But you looked, but a month ago, not you personally, but your officials said that between Academ and Dynacare, that you'd have 2,800 by now, and you just said 2,500, so.
Yeah, I mean, we're talking about both the be able to collect it, to run the test, to get that back within the 48 hours. So if we go count, maybe it might be at 2,800, it might be at 3,000. Certainly 2,500 is something that we have the ability to do daily right now.
When we get to the 3,000 promised by the Premier on April 28th.
Well, I bet you, I mean, we're probably at that if we had 3,000 tests in, we could do it. How long that specific number is there, it's because remember, we have Dynacare, we have a CPL doing it, we have the collection sites, there's a number of factors in it. So, so I think that if we hit 3,000 right now in a few days, we would certainly be able to do that, but I don't know how long that would be sustained, yeah.
What percentage of tests are done through pooled testing?
Yeah, it's a good question. I don't know the percentage of it. So for for most of the samples will be done through the pooled sample, and as long as our percent positivity is below 5-6%, it works quite well. Once you get above that, then it's really challenging to pool samples.
How many do you do at a time when you do pool?
That varies too with the percent positivity. So it can be 4 to, I believe right now they're doing 6 or 8 at a time. Yeah.
So if you do 6 or 8 and they're all negative, it's all good.
It's all
but
done.
if it turns out positive, then you got to go back and do
Got to
each
break
one.
that down. Yeah.
But overall, when you do this, it's
You
a
test
better
many-
use of your resources.
That's exactly right. Yeah.